Hi, it's Dr. Denny over at Formposite Fulsher Veterinary Clinic, and Maddie and I are going to be chatting a little bit about everything you might need to know if your cat has cancer. So she's going to start us off with some questions.
Dr. Denny, what is cat cancer?
So cancer is cancer. It doesn't matter what species you're in, but it is basically a group of cells that is dividing abnormally. So they're not listening to what they should be doing, and they're rapidly dividing. That's kind of your basic definition of cancer.
How will cancer impact my cat's health and quality of life?
So, cancer is called cancer because it can destroy healthy tissue, it can cause pain, decreased appetite, it can affect organ function. So, all in all, cancer is bad news bears.
What are some of the most common types of cat cancer and their symptoms?
I would say probably the most common type of cancer we see in our cats is probably something called squamous cell carcinoma, particularly in our white cats. They can get it in their mouths, on their ears. Cats, I mean, any animal can develop any type of cancer. I mean, there's tons of different types of cancers. But that's probably the most common ones. Cats can also get lymphoma, which attacks mainly the gastrointestinal system. So, cats with chronic gastrointestinal upset or GI upset, like diarrhea or chronic vomiting, that can be a symptom of gastrointestinal lymphoma and unfortunately can metastasize to the liver, to the spleen. Lymphoma can do pretty much whatever it wants. So, if your cat's experiencing chronic vomiting or diarrhea or weight loss, then we need to go ahead and get them in and have a conversation.
How will a veterinarian diagnose cancer in my cat?
So it depends. Sometimes the cancer is visible. So if your cat has a tumor or has a growth, like that's something that you can physically see, touch, etc. Sometimes it's not so easy. You know, if there's a growth in the mouth, you may notice that your cat isn't eating as well, or is maybe only eating on one side, or maybe is like eating little bits of kibble and then kibble is falling out one side of their mouth, indicating the mouth hurts. But generally, the symptoms are going to be really subtle. So we really rely on symptoms from at home. Like I said, chronic vomiting, diarrhea, decreased appetite, weight loss, drinking more and urinating more. Like there's the whole host of symptoms, but we really rely on the history of what's been going on to start to build a clinical picture. And from there, do a physical exam. From there, talk about diagnostics like blood work or x-rays, or if in cases where we have a bunch of tummy upset, an abdominal ultrasound is going to be really helpful. And in other cases, sometimes getting biopsies of the intestines can actually get us a very clear diagnosis as well.
If my cat does have cancer, what types of treatment options may be recommended?
So there's certainly oral medications that can be given. There's palliative care to control the symptoms. There's referral to oncology where we can talk about radiation and chemo. Chemotherapy in our pets is completely different than it is in humans. So we're not going for a cure, we're going for remission and quality of life. So we don't see near the side effects that we do in human medicine. I feel like I say the words oncology and chemotherapy, and my clients go, ugh! Because we think about, if we've had a family member go through chemo or what we've seen on TV, it's horrible. We're not putting our pets through that. That's not the goal. So the side effects and the risks are much lower when we're dealing with oncology and veterinary medicine. But those are some of the treatments, pain control. In some cases, surgery might be curative. So it really depends on what type of cancer, and then we go from there.
Why is early detection and diagnosis of cancer in cats so important?
Yeah, so it's the same as with human, like women and breast cancer, right? Early detection is super important. You catch something early, you have a chance of getting rid of it before it has a chance to spread. So, I think this is why getting your cat in every single year for exams is so important, because something that you may think is normal for your pet may actually not be normal. You'd be surprised at how many clients I have come in that say, well, my cat, I mean, he throws up a few times, but that's normal for him. And I turn that question around. I say, if this was you, would it be normal throwing up 3 times a week? Is that normal? And I think when we reframe that in our heads that, hey, this is actually not normal and that's a problem, these early indicator signs are what we rely on. So early detection is super crucial.
Why is it so important to avoid self diagnosing cancer in my cat?
Because you could be wrong, and you don't have the tools to treat. Like you're not going to know, like even if you are a medical doctor listening to this talk, you're not going to know the anatomy and the physiology. Like cats are not small humans. There's different medications, different therapies, there's different options. So self-diagnosing is never a good idea because you could be wrong, and when you are wrong, then we're delaying appropriate care and diagnosis, and to the detriment of your cat and their lifespan. So I think it's really important to bring them in. So I hope this helped answer some questions you might have about cat cancer. If you do think that your cat is exhibiting some of these symptoms that we talked about today, let's go ahead and get you in for an appointment. Feel free to give the clinic a call and we'll get you seen. Thank you.